Oh, hi. Are you here for the ward round? Excellent. These are my 3 patients in this bay that will all need seeing. Bed 1 is Charlotte Brown. Her blood pressure is still a little bit low. She's scoring a 5 on the National Early Warning Score. She came in a couple of days ago with DMV. She's still not really tolerating much food or drink. She's had 2 days of IV fluids. There isn't any more prescribed and she's still complaining of abdo pain. If you don't mind reviewing her and looking at her news score, and also if I can give her anything for the pain. She also said she had a headache this morning. Bed 2 is Charlie Braun. She came in with a possible pneumonia. She's scoring a 6 on the National Early Warning Score, which is down from 9. She was treated initially for a productive cough, had some IV antibiotics over the last couple of days. I've discontinued her fluid balance chart and because she's got no further fluids prescribed. I'm giving regular analgesics for a sort of a pleuritic chest pain that she had when she came in, and that seems to be resolving. Her temperature's come down a bit and her oxygen's gone up, so she is only scoring a 6 now, but it still does need a review. And I did send off sputum and bloods when she came in, and I've not seen any results for those. I do need a plan for her antibiotics, and if you want any more fluids. And the respiratory team have already seen her, but they didn't add much input.
Oh, that's cool.
And then the final bed is Claire Brown. She's a little bit more confused than she was. So I've asked her husband to come in and he thinks that she's looking a little bit pale. She came in with a possible urine infection. She's had a little bit of abdominal pain, but I'm not really sure what the plan is with her. If you could review her and let me know if there's anything you need to do. And then the 4th bed, we're just waiting for a patient to come up from A&E, so I'll let you know when they arrive. If you want me to do anything, give us a shout. I'll be around. All right, cheers.
Okay, so your first question is, how do you feel?
I'm just breathless and sweaty.
Next question is, any shortness of breath or breathlessness?
Yeah. It's worse if I have to walk to the toilet.
Next question is, are you coughing?
Sorry, what did you say?
Are you coughing at all, and are you bringing anything up?
Yeah, I'm bringing some green muck up.
Are you bringing up any bloody sputum?
Not that I've noticed.
And are you having any chest pain at all?
Some right side, especially if I cough or to try and take a deep breath.
Have you been having any swelling in your legs?
My ankles have been a bit puffy, that's all.
Have you been on any sort of long haul flights or long car rides?
Came back from Egypt 3 days ago.
Were you around anybody unwell during that time?
I wasn't well for a couple of days. I had diarrhea and vomiting, but that was all. But there were other people there, apparently, that had to take antibiotics.
Any family history of blood clots?
Not as far as I know.
And are you on any sort of hormone replacement?
Yeah, on HIV.
And do you suffer with any medical conditions?
Yeah, I'm on warfarin. And I've got high blood pressure.
And what medications do you take regularly?
Oh, the warfarin. and the blood pressure begin to raise. Can't remember.
And are you allergic to anything?
Not as far as I know.
And I'm just going to ask you about your social history, so I need you to comment on alcohol, smoking, and what you do for a living.
I drink. Usually black and white at the weekend. I smoke 20 a day usually. I work in an office.
Hi. Do you mind if I examine you? So it's going to be me listening to your chest, your back, having a look at your hands, your face, and your legs. Is that all right? All right. So I'm just going to take a little look around, okay? Can I start with the hands? Just put them out for me. Do you think you can put your arms out straight and then just bring your wrists back like you're stopping a bus, okay? All right, that's fine. Do you mind if I just look in your eyes for a second? That's fine. All right. Do you think it'd be possible for you to step forward for me? All right. So now, can you take a deep breath in and out? I'm just gonna tap on your back. Tell me if it hurts, okay? Next thing I'm gonna ask you is if you could say 99 every time I put my stethoscope down on your back.
99. 99. 99. 99. 99. 99.
And big deep breaths. Just sit back for me. So I'm going to do all that over again on your chest, okay? So the first thing I'm going to ask you to do is take some big deep breaths in and out. And again. Just going to tap now. So can we just say 99 again?
99. 99. 99. 99. 99. 99.
Big deep breaths. Any pain back here? No. Just gonna press on your leg a little bit. Alright. Okay, thank you. So on examination, she's obviously having some difficulty breathing with coughing, and she was a bit tender with some big deep breaths. She's on oxygen. She's got crocus on the right base, but on her lower legs there's no sort of calf swelling or tenderness, but she does have bilateral pitting edema, but doesn't really look like any sort of signs of DVT right now. And are you dizzy?
I do feel dizzy.